The world changed dramatically in late 2019. A new virus emerged, altering the course of our daily lives in ways we could never have imagined. Streets that were once bustling with activity became eerily quiet. Public squares, airports and train stations, usually filled with the hustle and bustle of people, stood empty and silent. This new virus, which we now call coronavirus or COVID-19, brought about unprecedented changes. People around the world began wearing masks, a simple yet powerful tool to protect themselves and others. The sight of masked faces became a common scene in cities, parks and public spaces. The virus spread quickly across the globe, transcending borders and affecting every corner of the world. International travel came to a halt, and crowded city streets and busy marketplaces saw a significant reduction in foot traffic. The rapid spread of the virus led to a global pandemic, changing the way we live, work and interact with one another. Coronaviruses are a large family of viruses that are common in animals. They can infect a variety of animals, including wildlife and farm animals. These viruses have been around for a long time, but not all of them affect humans. However, some coronaviruses can jump from animals to humans, leading to outbreaks. This is what happened with COVID-19. The virus likely originated in animals and then made the leap to humans, causing widespread illness. Some coronaviruses cause mild illnesses, like the common cold. These viruses are usually not a cause for concern and are a part of our everyday lives. We have all experienced the symptoms of a cold at some point, such as sneezing, a runny nose, and a sore throat. However, other coronaviruses, like COVID-19, are much more serious. COVID-19 is highly contagious and can lead to severe illness and complications. Hospitals around the world have been overwhelmed with patients, and healthcare workers have been on the front lines, working tirelessly to care for those affected. The high contagion rate of COVID-19 means it spreads easily from person to person. Crowded places, such as public transportation, busy sidewalks, and markets, became hotspots for transmission. Social distancing measures were implemented to reduce the spread of the virus. The virus spreads through respiratory droplets that are released when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. To prevent the spread of these droplets, it is important to cover your mouth and nose with a tissue or your elbow when you cough or sneeze. Wearing masks and maintaining physical distance from others are also crucial steps in reducing transmission. Scientists around the world have been working tirelessly to understand COVID-19. Research is being conducted to learn more about how the virus spreads, its effects on the human body, and how it can be treated. Laboratories are buzzing with activity as researchers work around the clock. In addition to understanding the virus, scientists are also working to develop treatments and vaccines. The development of vaccines has been a monumental effort, with researchers racing against time to create safe and effective vaccines to protect people from COVID-19. Since the emergence of the virus in 2019, we have learned a lot about COVID-19. Significant milestones have been achieved in understanding and combating the virus. People around the world have adapted to a new normal, finding ways to live and thrive despite the challenges posed by the pandemic. COVID-19 affects people differently. Some people have no symptoms at all, others experience mild to severe illness. Symptoms usually appear 2 to 14 days after exposure to the virus. Common symptoms of COVID-19 include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. There are steps you can take to protect yourself and others from COVID-19. These steps are important even if you have been vaccinated. Get vaccinated and boosted as soon as you are eligible. Wash your hands often with soap and water for at least 20 seconds. Use hand sanitizer if soap and water are not available. Avoid close contact with people who are sick. Stay home if you are sick. Cover your mouth and nose with a tissue when you cough or sneeze. Clean and disinfect frequently touched surfaces. Scientists believe that COVID-19 originated in bats. The virus likely jumped from bats to humans through an intermediate animal. This intermediate animal has not yet been identified. The first cases of COVID-19 were reported in Wuhan, China, in December 2019. The virus quickly spread throughout China and then to other parts of the world. Understanding the origins of COVID-19 is important for several reasons. It can help us develop better ways to prevent future outbreaks. It can also help us understand how viruses evolve and spread. Section 5. Global impact countries hit hardest. COVID-19 has had a devastating impact on the world. The virus has infected millions of people and caused hundreds of thousands of deaths. The pandemic has also had a profound impact on the global economy. Some countries have been hit harder than others. Factors that have contributed to the severity of outbreaks in different countries include population density, healthcare capacity, government response, and public compliance with health measures. Section 6. A global fight: collaborative efforts against the virus. The fight against COVID-19 has been a global effort. Countries have worked together to share information, resources, and expertise. International organizations such as the World Health Organization have played a critical role in coordinating the global response to the pandemic. The WHO has provided guidance to countries on how to prevent, detect, and manage COVID-19 cases. Section 7. The current state of the pandemic. The COVID-19 pandemic is ongoing. However, the situation has improved significantly in many parts of the world. This is due in part to the widespread availability of vaccines. Vaccines are highly effective at preventing severe illness, hospitalization, and death from COVID-19. As more people get vaccinated, the spread of the virus is expected to slow. However, it is important to remain vigilant. New variants of the virus are emerging. Some of these variants may be more transmissible or more resistant to vaccines. Section 8. Coronavirus in context: comparisons with similar viruses. COVID-19 is not the first coronavirus to cause a global outbreak. Coronaviruses are a large family of viruses that can cause illnesses ranging from the common cold to more severe diseases. The most notable ones before COVID-19 were SARS and MERS. In 2003, the SARS coronavirus emerged in China. It was identified as the cause of an outbreak of severe acute respiratory syndrome, or SARS. The virus spread quickly, causing widespread concern and prompting global health measures. SARS spread to more than 24 countries, causing over 8,000 cases and 774 deaths. The outbreak was eventually contained through public health interventions, including isolation and quarantine measures. In 2012, the MERS coronavirus emerged in Saudi Arabia. MERS, or Middle East Respiratory Syndrome, was first identified in a patient in Saudi Arabia and has since been linked to camels as a possible source of infection. MERS has since spread to other countries in the Middle East, as well as to Africa, Asia, and Europe. Although it has not caused as many cases as SARS or COVID-19, it has a higher fatality rate, making it a significant concern for health authorities. MERS has a higher fatality rate than SARS or COVID-19, but it is less transmissible. This means that while it is deadlier, it does not spread as easily from person to person. Understanding these differences is crucial for developing effective public health strategies and responses to future outbreaks. Section 9. Looking ahead, key takeaways and future directions. The COVID-19 pandemic has been a global crisis affecting every corner of the world. It has brought unprecedented challenges and has forced us to rethink how we live, work, and interact with one another. It has tested our healthcare systems, our economies, and our social fabric. Hospitals have been overwhelmed and many people have faced long lines just to get basic necessities, like groceries. However, it has also shown the power of human ingenuity and collaboration. Scientists around the world have worked tirelessly to understand the virus and develop vaccines, while communities have come together to support one another. We have learned a lot about COVID-19 since it first emerged. Researchers have gathered vast amounts of data, which has been crucial in developing effective strategies to combat the virus. We have developed effective vaccines and treatments. The rapid development and distribution of vaccines have been a monumental achievement, saving countless lives and helping to curb the spread of the virus. We have also learned the importance of public health measures such as mask wearing and social distancing. These simple actions have proven to be effective in reducing transmission and protecting vulnerable populations. The future of the pandemic is uncertain. While we have made significant progress, there are still many unknowns, including the potential for new variants and the long-term effects of the virus. However, by continuing to work together, we can overcome this challenge and build a healthier, more resilient world. It is through our collective efforts that we can ensure a better future for all, where we are better prepared for any challenges that may come our way. As we look ahead, it is important to remember the lessons we have learned during this time. We must continue to invest in healthcare, support scientific research, and foster a sense of community and solidarity. By doing so, we can create a world that is not only more resilient to pandemics, but also more equitable and just. The pandemic has highlighted the disparities that exist in our societies, and it is up to us to address these issues and work towards a better future for everyone.